Hi all, this is Dr. Raja Krishan, a physiotherapist, and I'm assistant professor working in SNS College of Physiotherapist. And we are going to see about the abdominal wall anatomy and the surgical incisions for general medicine or surgery in BPT, TN, Dr. MGR University students. We are going to the topic. First, what is the abdominal wall? The abdominal wall is the layers of muscles and some sheaths and some organs and the cavity inside the peritoneum. These are the structures in the abdomen. It is a complex multi-layered structure. One by one, all the things are going to uh, cut and we are going to see inside what is all the structures. First, in the abdominal wall, in anatomically, it's a complex, as we said, it's a complex multi-layered structure. We can divide it into, it is derived from the blood supply which is supplied and the innervations of the muscles, the innervations of the nerves it is given. The structures, the protections on well-versed, structured, to protect the abdominal organs in the peritoneal cavity. In the embryology means how the organ develops. In the embryology, the mesodermis is the origin and it's originate from the paravertebral region, the bilateral migrating sheets, develop into the bilateral migrating sheets, and the abdominis enveloped in further. First layer of the abdomen is the skin. The second layer of the abdomen is after the skin. There the fatty layers are there. The fatty layers means the adipose tissue, and then the muscle layer is there. After the muscle layer, the facial layer is there. Then the peritoneum, then the great romentum or small romentum. Then the loops of small intestine are the underlying structures of the abdominal wall. Then after to this, as we see, it is the anterior abdominal wall. In the anterior abdominal wall, superiorly it is structured by the xiphoid process of the sternum and the costal margins of the ribs. Inferiorly, the tubercle of the iliac crest, the ASAS, that is anterior superior iliac spine, and the pubic symphysis are structured. And posterior laterally, the mid axillary line is there to divide it from the anterior and posterior abdominal walls. Then topographically, the structures are divided into four quadrants. One is the abdominal quadrant, the one is the right upper quadrant and the right lower quadrant. Then left upper quadrant and the left lower quadrant. Four quadrants. That is divided in by two intersecting lines called the trans umbilical plane and the median plane. And then it is divided into 9 regions with of two pairs. One is vertical plane and another one is the horizontal plane. In the vertical plane, there are right and left mid-clavicular planes, and in the horizontal plane, there are transpyloric plane and transtubercular plane is there. This is divided into 9 abdominal regions as from first, it is right hypochondrium, then epigastric region, left hypochondrium, right flank, umbilical region, left flank, right groin, pubic region, and the left groin. Uh, in this stage, you may have a doubt that why we should study these regions. Why it is necessary to a physio, to a physiotherapy student to study all these in that syllabus. It is none other than that we have to know the source of surgery. Then we can decide biomechanically whether it is stopped by an recent surgeries. For example, if the person is having a hernia, operated hernia, then he may develop an shoulder pain according to the hernia operated because the fascia will be full in that region. So according to that, we can treat the patient, and also there may be any surgical uh, failures so that the patient may develop any pain in that region. So we have to know what surgery is made, what is done in that patient. After that, we can go for the rest of the things. So This is the very important topic for every physio student. Thus, they should know what is the procedures done, what are the regions in the abdomen, and what are the cuts made in the abdominal layers. In the upcoming videos, we will see what are these in the next parts. Thank you.